Did you know that one simple habit you might be doing every single day could be quietly raising your risk of a stroke overnight? All right, I'm talking about something so common, especially as we get older, that most of us don't even think twice about it. It's not smoking or skipping exercise. It's something sneakier hiding in your daily routine. Stick with me for the next 12 minutes, and I'm going to walk you through what this habit is, why it's so dangerous for seniors, and exactly what you can do to protect yourself starting today. Plus, at the end, I've got a surprising tip that could make a huge difference in keeping your brain and heart healthy. It's something you'll wish you knew years ago. Let's dive in and talk about how to keep you thriving for years to come. All right, now let's get real for a moment. As we age, our bodies change. Maybe you've noticed your energy isn't what it used to be, or you're more careful about your balance when you walk. All right, these are normal parts of getting older. But there's one thing that worries me for senior stroke risk. Every year, about 800,000 Americans have a stroke, and the risk doubles every decade after age 55. That's a scary number, and it hits close to home for many of us who want to stay active, independent, and there for our families. The habit I'm talking about today isn't just a small quirk. It's something that can damage your blood vessels over time, making a stroke more likely. Oh, okay, and the worst part, you might be doing it without even realizing it. I'm talking about eating too much added sugar, especially at night, that late-night ice cream, those cookies with your evening tea, or even that sweetened bedtime drink could be setting the stage for trouble. But don't worry, I'm not here to lecture you. I'm here to share why this matters and give you simple, practical ways to turn things around so you can feel empowered and in control. All right, here's why eating too much sugar, especially late at night, is such a big deal. When you eat sugary foods, your blood sugar spikes, and over time, those spikes can harm the delicate lining of your blood vessels. All right, think of your blood vessels like the pipes in your house. If you keep clogging them or wearing them down, they can't do their job properly. For seniors, this is extra important because our blood vessels naturally get stiffer with age, and high sugar levels make it worse. This can lead to inflammation, high blood pressure, and even tiny clots that increase your stroke risk. Studies show that people who consume a lot of added sugar have a 20 to 30% higher risk of stroke compared to those who keep it low. And when you eat sugar close to bedtime, your body doesn't have time to process it before you sleep, leaving your blood vessels under stress all night long. That's what I mean by raising your stroke risk overnight. But here's the good news. You can make small changes to your habits and diet that can protect your brain and heart, and I'm going to share 3 simple strategies to get you started. All right, first, let's talk about timing your meals. This one's a game changer, and it's easier than you might think. Try to avoid eating sugary foods or even heavy meals within 3 hours of bedtime. Why? When you eat late, especially sugary stuff, your body is still working hard to digest and process that sugar while you're trying to rest. This keeps your blood sugar and insulin levels elevated, which can stress your blood vessels and heart. A study from the Journal of Clinical Endocrinology found that eating late at night disrupts your body's natural rhythm, increasing inflammation and blood pressure, 2 big stroke risk factors. So, what can you do instead? If you're craving something in the evening, reach for a small nutrient-rich snack like a handful of almonds or a slice of apple with a bit of peanut butter. All right, these options stabilize your blood sugar and give your body healthy fats and fiber to keep your blood vessels happy. For example, my friend Susan, who's 68, used to have a bowl of ice cream every night while watching TV. She switched to a small bowl of berries with a dollop of plain yogurt, and not only did she feel better in the mornings, but her doctor noticed her blood pressure was more stable at her last checkup. Small changes like this can make a big difference. All right, here's where it gets surprising. Did you know that some foods can actually help repair and protect your blood vessels? That's right, it's not just about avoiding sugar. It's about adding foods that fight back against stroke risk. One of my favorites is dark leafy greens like spinach, kale, or collards. These greens are packed with nitrates, which are natural compounds that help your blood vessels relax and improve blood flow. Alright, a study from the American Heart Association showed that eating just 1 cup of nitrate-rich vegetables daily can lower your risk of stroke by up to 14%. Plus, they're loaded with antioxidants that reduce inflammation. If you're not a big fan of greens, try blending a handful of spinach into a morning smoothie with some fruit to mask the taste. My patient John, who's 72, wasn't thrilled about eating kale, but he started adding a small side salad with dinner a few times a week. He told me he feels more energetic and his cholesterol levels dropped at his last visit. You don't need to overhaul your diet. Just add a serving of greens most days and your blood vessels will thank you. All right, now let's talk about a habit that's just as powerful as what you eat movement. You don't need to run a marathon or hit the gym for hours. Small bursts of activity can do wonders for your stroke risk. Regular movement, even something as simple as a 15-minute walk after dinner, helps lower blood sugar, reduce inflammation, and keep your blood vessels flexible. A study from Harvard found that seniors who walk briskly for just 150 minutes a week, that's about 20 minutes a day, cut their stroke risk by nearly 30%. Walking after a meal is especially helpful because it helps your body use up excess sugar before it can do harm. Picture this. You finish dinner, maybe a light meal with some grilled chicken and veggies, and then you take a stroll around the block with your spouse or a friend. All right, it's not just good for your body. It's a chance to connect and clear your mind. My neighbor, Linda, who's 66, started doing this with her dog every evening, and she says it's become her favorite part of the day. She's lost a few pounds, and her doctor says her blood pressure is the best it's been in years. So, lace up your shoes and make movement a daily habit. It's like giving your blood vessels a tune-up. All right, here's another tip that might surprise you. Hydration matters more than you think. Dehydration can make your blood thicker and stickier, which increases the chance of clots that can lead to a stroke. As we age, our sense of thirst can weaken, so seniors are especially at risk of not drinking enough water. A study in the journal Stroke found that even mild dehydration can raise stroke risk by affecting blood flow to the brain. All right, the fix. Aim for about 8 glasses of water a day, but you can also get hydration from foods like cucumbers, watermelon, or even herbal teas. If plain water feels boring, try adding a slice of lemon or a few mint leaves for flavor. My patient Robert, who's 70, started carrying a reusable water bottle with him everywhere, and he noticed he felt less sluggish and more alert. He even swapped his evening soda for sparkling water with a splash of cranberry juice. Little tweaks like this can keep your blood flowing smoothly and lower your stroke risk. All right, before we wrap up, I promised you a surprising tip, and here it is. Spice up your meals with turmeric. This golden spice, often found in curry dishes, contains a compound called curcumin that's a powerful anti-inflammatory and antioxidant. Research from the Journal of Nutrition shows that curcumin can improve blood vessel health and reduce the risk of clots, which are a major cause of strokes. You don't need much. Just a pinch in your soup stews or even scrambled eggs can make a difference. All right, if you're on blood thinners or other medications, check with your doctor first. But for most people, turmeric is a safe and delicious way to support your health. My friend Mary, who's 64, started adding a little turmeric to her morning oatmeal, and she swears it's helped her feel more vibrant. It's a simple way to give your body an extra layer of protection. All right, so let's bring it all together. By avoiding sugary foods late at night, eating more dark leafy greens, moving a little every day, staying hydrated, and even adding a sprinkle of turmeric, you're taking powerful steps to lower your stroke risk and keep your brain and heart healthy. All right, these aren't huge, overwhelming changes. They're small, do noble habits that fit into your life. As a senior, you deserve to feel strong, independent, and full of energy for the things you love. Whether that's playing with your grandkids, gardening, or just enjoying a quiet evening at home, by making these changes, you're not just reducing your stroke risk, you're investing in a longer, healthier life. If you found this helpful, give this video a thumbs up, share it with someone you care about, and let me know in the comments what small change you're going to try first. I'm rooting for you, and I'll see you in the next video. Stay healthy, stay curious, and take care.